right, Deja, thank you very much. A new study from the University of Minnesota reveals more on how COVID-19 might spread indoors.
Okay, look, the study modeled how COVID-19 particles spread from the mouth across a classroom and found only 10% of the virus particles were filtered out with good ventilation. Another study from the University of Florida found the virus can spread up to 16 feet away potentially from an infected person.
So these new potential findings all coming ahead of an expected announcement from Kansas City Mayor Quinton Lucas tomorrow on whether or not he will be easing or further tightening COVID-19 restrictions in our area. The current restrictions set to expire on Saturday. That could change tomorrow with the mayor's announcement. So this morning, as always, we're joined by Dr. Dana Hawkinson live from the University of Kansas Health System. Doctor, we're really glad you're with us this morning, as always, especially with new information out there, these new studies, new opinions. It's scary to people. We're already kind of scared enough and on edge enough, and then the idea that it could be even more difficult to protect ourselves than we thought. Is 6 feet enough when we're standing inside away from people, do you think?
Yeah, I've only seen one of these articles in print. The other ones, of course, were just the media news stories about them. I don't think that these articles, these journal publications, and one of which I think is still only a preprint, hasn't been peer-reviewed, changes anything we do. I think it's good black and white knowledge about what we thought, but we have always said infection or exposure is related to time and proximity. So the closer you are to somebody, the more concentrated any expressed virus is going to be. So as you get further out, 3 feet, 6 feet is better than 3 feet, 8 feet is better than 6 feet. If you have other barrier methods such as masks, and we've seen some new publications about masks as well, that will all work to reduce the concentration of the virus in the environment around you. The World Health Organization uses 3 feet. Well, that's because many of the people in the world can't separate more than 6 feet. The CDC uses 6 feet. But we've always still said that 8 feet is better than 6 feet, 10 feet is better than 8 feet. How reasonable is it to do that in every situation? It's difficult. So these articles are good. They provide us with some concrete numbers, but I don't think it changes much of what we are doing, and the fact that if you can distance yourself and not gather in large groups as much as possible, that will help. And again, what is the amount of virus concentration or droplet concentration in that area around you as well? We have to understand that even though you can detect it, those concentrations do go down the further you get away from somebody who is expressing the virus.
Now, Doctor, we've heard you talk before that another way to protect yourself from COVID-19 is to wear goggles or eye protection along with that mask. And you mentioned it on voting day. That'd be a good idea. And you guys also had them out on your call, you and Dr. Stites.
Yeah.
I'm just wondering, even from a personal standpoint, when you go out, if you go out, is this to a point where you believe you wear the goggles with the mask now and you go to the grocery store? Do we really need to be wearing these in public also?
That's a very good question. Certainly when I go to the grocery store, I wear my mask. When I go to the gym, I wear my mask. I haven't got into the situation yet where I felt I needed to wear the goggles. The mask, again, is a barrier, provides a barrier for everybody else if you are expressing virus into the environment. It can also provide protection for you. Certainly when I flew, I wore goggles as well as the mask. That is one thing to consider if you know you are going into situations. Again, I would not advocate being in situations with large gatherings or going to bars or house parties or anything like that. But if you think you're going to be in those situations, that is one other piece of protection you can use so that the virus doesn't get into your mucous membranes. Your mucous membranes are your mouth, your nose, and your eyes. Obviously, if you're wearing your mask correctly, the mouth and the nose are going to be covered. The eyes will also be covered if you wear eye protection.
Interesting to talk about that when there's so many people that we see that are still not exactly wearing the mask correctly. You see a lot of noses peeking over those masks all the time. So to add another layer, I think would be difficult for a lot of people. We want to ask you our last question this morning about a heart condition that could be linked to COVID-19, because we're talking more about athletics as we get closer to professional seasons. We've talked about college football being canceled in some cases, high school sports getting there. It's catching the eye of a lot of parents, specifically parents of athletes with this heart condition that might be tied to COVID-19. What can you tell parents about that this morning?
Yeah, a lot of the impetus with this was people who really survived and who had mild to moderate illness. They found that on MRI, which is a very sensitive imaging modality, that people had changes in their heart even after very light illness with COVID-19. We don't know the full implications of that. Will you recover? What are the implications of somebody who has had COVID-19, who has changes in their heart? Obviously, the issue is if you're out exerting yourself, if you're an athlete, if you're doing certain sports, what danger does that bring to you? So we don't fully understand. We know that in autopsies on people who have died with COVID, they can see changes in the heart with inflammatory cells. They can detect the RNA of the virus. So these are some of the things that not only the acute illness of COVID-19 that we're looking at, but what are the short-term and other long-term effects of having the illness. And I think that is one of the major areas of study now, especially for athletes moving forward.
We are learning so much every day. Dr. Hawkinson, thank you so much for joining us this morning.